Well, good afternoon. Is everybody still awake after lunch? Maybe. Well, thank you guys so much for having me here today. I'm really excited to be here. I did want to give a quick shout out. I'm so excited to see a lot of our FQHCs that are here today. We have Family First, Universal Primary Care, we have PHMC. I know the Wright Center has been involved with this program as well. So it's very exciting to see everybody here. I wanted to talk to you today a little bit about the Primary Care Association and the Career Center, as Helen mentioned, and kind of talk to you a little bit about some of the workforce state of affairs, which we've kind of heard a lot about today. I'll try not to repeat too much, and also talk a little bit more in depth about those debt reduction opportunities, and give you some examples of more examples. We've already heard some really great examples today, but more examples of ways that our health centers are addressing some of these workforce shortages. All right, so a little bit about PAC. PAC is the Pennsylvania Association for Community Health Centers. We are the state's primary care association. Some of you might be familiar with us, some of you may not. We do get federal funding to provide support for the federally qualified health centers, lookalikes, and some of our rural health clinics across the state of Pennsylvania. Every state has a primary care association, so we serve Pennsylvania. And I serve as the director of the Pennsylvania Primary Care Career Center, which is a joint effort with the Department of Health through the Primary Care Office, which is different than the Primary Care Association. A little confusing, but they're two different entities. And we get grant funding to run a career center where we help find open positions and we help connect providers and other job seekers with positions in community health centers across the state of Pennsylvania. We do a lot of education. I was telling Dean Wolf, I was just at his university on Monday talking to his dental students about careers in community health. We go and talk to different training programs about careers, about loan repayment options. We run the state's 3R Net account. 3R Net is the National Rural Recruitment and Retention Network. It's a nationwide job board that is specifically geared towards folks looking to work in underserved communities. So we run the state's page on that, and we're a little bit of a candidate sourcing service for our health centers where we'll go out and try to recruit at different career fairs or different institutions and connect folks with community health centers who are hiring. So that's a little bit about us. PAC is really excited to have 100% membership with the community health centers in Pennsylvania. We're very proud of that, and we try really hard to keep that alive there. We have a staff of 17, soon to be 18, hopefully. We're expanding a little bit, which is great. So we're a small but mighty staff that's supporting the whole state. One of my coworkers, Eric, is here. He's going to be talking a little bit later on. He's the director of policy. But we all have areas that we try to support the health centers on. My, obviously, area is workforce. Eric's is advocacy. We have folks that help with the clinical end of things, the dental, billing, outreach. So we're just here to support the health centers that are doing such great work in the state of Pennsylvania. I just want to level set. I know a lot of you may already know what a community health center or what you might hear a federally qualified health center might be, but just in case there's some folks in the room who aren't quite as familiar, I did want to level set a little bit. So federally qualified health centers receive federal funding to help anybody who walks through the door, whether or not they are insured, whether or not they can afford to pay for services. Where they have a sliding fee scale to help determine how much that person can put towards their services, and it might be zero, and that's okay. They're still going to receive the high quality care that they came in for. These health centers include primary medical, dental, and behavioral health services, typically in a one-stop shop, which is a really neat model. So if somebody comes in for a medical appointment and they discover in the course of their exam that they have some oral health issues, they can send them down the hall to the dentist, and the dentist can help them out with that. A lot of these health centers have services beyond those three as well. Some have podiatry services or vision. There's a lot of, with the Rite Aid closures, a lot of them are responding by instituting a pharmacy. And they also do a lot of wraparound services. So just beyond the operatory or beyond the exam room, they're providing ways to make sure that their patients get access to the care that they need, whether it's through transportation, assistance with food insecurity. There's a health center that helps provide like baby supplies for expectant mothers. They are responding to the needs within their individual communities. And something else that's really unique about health centers is that they're community-led. So 51% of their board must be made up of patients in their community. So these community health centers are able to respond to the needs of their community so well because they are being governed by the community. Here's just a little bit of information about the types of patients that they see. They see over 16,000 veterans, over 22,000 agricultural workers, 174,000 uninsured patients, 31,000 homeless, 152,000, almost 153,000 older adults, and then 314,000 children under the age of 18. So they're seeing the whole gamut of patients in their community. So let's talk about the oral health workforce. That's kind of the main reason why I was here today and asked to come speak. But we've talked about this a lot. You've heard people say, especially Dr. Verber gave a really great example of you just kind of like are trading hygienists. You know, like it seems so hard to find people to staff the clinics, and especially in shortage areas. Which is very interesting phenomenon because Pennsylvania, as Dean Wolf kind of mentioned, we're very rich in oral health schools. I have the privilege of networking with other primary care associations in other states, and I'm like, wow, we're really lucky here in Pennsylvania. Like, there's some states that have like 1 or even 0 dental schools. So like, they have to go out of state to try to recruit from dental school. So we're very lucky to have a lot of different institutions to look for. But even though we are lucky in that area, as we've heard a lot today, it's still very difficult to recruit and to fill that workforce shortage, especially in safety net facilities like federally qualified health centers. So you can see there's some pretty scary projected shortages. This applies to all areas of primary care, but specifically I wanted to point out dentists, we're doing okay. It's not the worst, but you can see especially with hygienists, we've heard this talked about already today, in 2037, there's going to be a major shortage anticipated for hygienists. So I did want to also do a little bit of level setting because this is really coming into practice, and this is a little bit of a complicated concept, but it's something that's very important to understand in the state of Pennsylvania of a HPSA score. A HPSA stands for Health Professional Shortage Area. This is a federal designation that the information is kind of run through our primary care office, so through the Department of Health, to get a shortage designation score. There's 3 categories. There's primary medical, there's dental, and there's mental health. And these scores are measuring how big of a professional shortage is in that particular area or facility. It can be, there's a couple different types of scores. You can be a designated shortage area in a geographic area. It could be a low-income population designation, or it could be a facility. Community health centers are automatic facility HPSAs. So they all have a HPSA score, but there's also other types of HPSA scores out there as well. Primary medical and mental health run on a scale of 0 to 25, so the higher the score, the bigger the shortage. Dental actually runs on a scale of 0 to 26. And generally speaking, Pennsylvania's dental HPSA scores are rather high, which should be no surprise to anybody because that's what we've been talking about all morning. There's just a little bit of information about how they're calculated. It is a little bit of a complicated calculation, but I'm happy to talk to anybody off, later on if you want to get more into it. But it looks at population to provider ratio, the percentage below 100% of the federal poverty level, the water fluoridation status, which I know is a hot topic right now, and then the travel time to the nearest source of care. In Pennsylvania, we have, you can see there's a little chart down there, but we have 154 HPSAs in Pennsylvania. Most of them, you can see, are low-income and federally qualified health centers. Rural health clinics also get a designated HPSA score, but that's kind of the state of the HPSA. And that comes into play a little bit later on, especially with some of those loan repayment programs, which I'll talk about. But this is just so that everybody knows what their HPSA score is. And if you hear somebody mention that, that's what they're referring to. Dean Wolf stole my thunder a little bit because this was in his slides too. But so I won't spend too much time on this one, but this kind of just gives you an idea of where the shortage areas are by county. That's, again, should be no surprise to anybody. So let's talk about some of those recruitment and retention tools. In order to effectively recruit providers, it's really important for anyone, but especially safety net facilities, to understand what the providers are looking for. And it really depends on if they're early on in their career or if they're later on in their career. So earlier on, you've heard the average debt is over $300,000 now for dental school. Their first priority is going to be salary compensation, because they got to pay for that student debt. So that's going to be something that's really important to someone seeking a job. Work-life balance. They just got through dental school. They've been putting in the long hours between the studying and the tests and the clinicals, and they're like, okay, I want like a normal schedule now. You look for a career advancement. That's very important, especially to the younger generation that's coming into the workforce now. Career advancement is something that's very important to them. Geographic location is another aspect that's going to be really important. This is to both early career and later careers. Often early careers, if they're unattached, they're single, maybe they want to go somewhere new and exciting. If they're settled down and they have a family, they're kind of tied to the area that their family lives in, so the geographic area is going to play a huge role. Autonomy is going to be another one, especially for the later career providers. They're established, they know what they're doing, they know how to take care of patients, and they just want to do their thing. Work-life balance is going to be important, especially if they have a growing family and they want to have some time to run the kids to soccer practice or see their concert. The work-life balance is going to be important. And then job satisfaction. They want to know that they're doing something to make a difference in folks' lives, and they've kind of put in their hard time and they just want to enjoy being a dentist or a hygienist or a dental assistant and making a difference in people's lives. So, what you've heard loan repayment programs talked about a lot today. This is a really good tool to help recruit and retain some dentists and dental hygienists within the state. There are two types of loan repayment programs. There's the state level loan repayment, and then there is the federal level loan repayment, which we'll talk about here. So the Pennsylvania Primary Care Loan Repayment Program, practitioners can get up to $80,000 in loan repayment in exchange for 2 years of service in a HIPSA. There comes that HIPSA term again, in a HIPSA in Pennsylvania. This does dentists and hygienists and public dental health practitioners, PhDHPs, they're all eligible to apply for this program. How it basically works is they have a pot of money to offer for loan repayment. They earmark about half of that for medical providers, about 25% for mental health, and 25% for dental providers. They prioritize applicants who are from Pennsylvania, who trained in Pennsylvania, and obviously you need to stay in Pennsylvania in order to be awarded this loan repayment. So they call it a SLRP, which I think is hilarious. State Loan Repayment Program is what SLRP stands for. It's kind of an odd acronym, but can you be a SLRP site? FQHCs, Certified Rural Health Clinics, lookalikes, those are all SLRP eligible. This is a whole list of sites that are eligible, but in addition to being that type of site, you also have to meet the qualification factors. So this is a both. Both columns are important, and I think you guys will I won't spend time reading through all of these. I think you'll have access to the slides later. But if you're interested, you do have to register your site and make sure that you're eligible for this loan repayment program. Then we have the National Health Service Corps. You heard Dean Wolf talk a little bit about that with his students. They have a couple different types of programs. There's a scholarship program, a students to service program, and then a loan repayment program. So the scholarship program is something that students can apply for while they're still in school. They can get multiple years or just 1 year of scholarship. This provides them with their full tuition, a monthly stipend, and applicable education fees. And in return, they have to give 2 to 4 years of service in a HIPSA, depending on how many years they receive the scholarship for. The Students to Service program is a loan repayment program. This is up to $120,000 in loan repayment award in exchange for 3 years of service, and this is something that folks will apply for in their final year of school. And then finally, you have the loan repayment program, which is similar to the state loan repayment program where you get up to $80,000 in award in exchange for 2 years of service. I do want to mention that dentists are eligible for all three. Hygienists are only eligible for the loan repayment program. So there's a little bit of a difference there. Along with those loan repayment programs, the scholarship program in particular and the students to service, they do have minimum HPSA score requirements in order to fulfill the service obligation. So here is the list. Dentists are sitting at a 14 for this current year. Every year they do update the score. So if somebody is interested a couple years down the road, they want to make sure, they want to double check this information. And then students to service also need to work in a place with a HPSA score of 14 or higher. The loan repayment programs don't necessarily have a minimum HPSA requirement, but the higher the HPSA score, the more likely you are to be awarded those programs. And can you be an NHC site? Here's a list of eligible sites, and once again, it has to be both an eligible site and meeting the qualifications. And this is another instance where you need to register your site to become an eligible site for these programs. All right. Wrapping up here with this last section, but we've heard a lot of really great ideas today about strategies to help strengthen the oral health workforce. I'm not sitting here saying I have it all figured out. These are just some ideas that I've seen looking at what our community health centers have done and the successes that they've had, that I've kind of put together a few themes that I think are important to share. So one is mentorship. How are you encouraging the young people in your community to pursue a career in oral health? We have some really good examples of that with some of our health centers. For example, one of our health centers, Primary Health Network, they have a summer internship program where they get connected with some high school students, they get them interested in healthcare, and then they try to follow them as they go through their training, just to get them interested and kind of be a mentor for them. There's also a couple models to shout out some of our critical access hospitals where they have a scholarship program through their foundation where they award a scholarship to a local high school student to go on to medical school. We could duplicate that for dental school. And then in return, once they're done, they have to come back and work for a set number of years. So that's kind of a way to get people to come back to the community while we're also recruiting in the community. Next, academic partnerships. You've heard a lot of really great examples today about different academic partnerships. Like the Pitt Dental Regional Training Programs is a great example. And I have another example that I'm going to talk about in a minute as well. And then training and upskilling. So how are you training and upskilling your current workforce to meet the needs of your clinic? And I'll talk about an example there too. But first I want to talk a little bit about a specific person that I had the pleasure of speaking with in one of our health centers, in Keystone Health Center in Chambersburg, Pennsylvania. She started off her job as a dental assistant. She was not certified though, so she came in as a dental assistant. And by working at Keystone, they offered her on-the-job training and tuition reimbursement, so she was able to get certified, and then eventually she went on to become an EFTA. And she has been there for the past 17 years. Like, that was a really good retention tool. She loves her job. She loves the work that she's doing in the community. And something that really cool that she said was she likes, it's like doing artwork. She's putting her artwork in people's mouths. I thought it was just a really neat, inspiring way to look at it. And then I want to just highlight really quickly the PHMC dental collaboration with Penn Dental Medicine. You heard Dean Wolf talking earlier today. I had the pleasure of getting connected with Dr. Jetla from PHMC. They have a partnership where the Penn Dental provides third and fourth year dentist residents and some faculty, and they provide care to the community in West Philadelphia at PHMC. They also have a really neat integrated medical program where, if there's an emergency urgent care situation in the same building, and if they see an oral health problem, they send them down to the dental piece. So it's, again, that collaboration and integration within the whole healthcare system that's really important. And finally, I wanted to talk a little bit, I talked about Kristen Thornton earlier at Keystone Health Center. They have partnered with a local community college to offer an accelerated dental assisting training program, and they hire employees. It started off where they offered this to their front desk staff. And then eventually they've moved on to also hiring outside folks to come in as a trainee. They have dedicated learning time built into their work schedule. They have an on-site person who is providing the hands-on clinical and lab work for them, and then they do their externship right on site, and then they're hired on as a full-blown dental assistant. This program is relatively new. I think it's only a couple years old. They've put through 12 dental assistants through their program, and they've retained all but one of them. So it's such a really successful program that they've had. And there's, I'm sure, many more examples. Those are not all inclusive of all the health centers and what they're doing, but those are just a couple examples, and I'm sure you'll hear more as you network today. But that's what I want to leave you with. Thank you so much for having me today, and I'm happy to connect with anybody later on too. Thank you.